actually presenting, just to reduce the kind of bandwidth issues or any issues with the internet. The session is being recorded as well, just so others who couldn't attend today can view it. So really, without further ado, I kind of want to thank and introduce our speakers for this afternoon. So that's Catherine Baker, who's PPI officer in the NIHR ARC Wessex, and Cynthia Russell, who's PPI champion in ARC Wessex and contributor and reviewer for other research and funding groups. And I'll pass straight over to Catherine.
Good afternoon, everyone. It's lovely to see quite a large group of people come to listen. So I would like to welcome you to this sort of talk, this webinar about patient and public involvement. We will also be talking about engagement today, as well, as there's now a move towards including more engagement when we talk about involvement. So it is lovely to see you all today, or not see you, but we also like to say if you have any questions, there will be a question and answer session at the end. Please do feel free to put any questions you have in the chat at the bottom, or sort of save them to the end, and Paul will sort of ask you to sort of ask them then. So I will get started without further ado. So when we talk about sort of what we're going to be talking about today, we're going to talk about what is patient and public involvement and what it isn't. Then we're going to talk about public involvement and public engagement. Then Cynthia very kindly is going to speak about lay summaries and her experiences. And then we're also going to talk about how do I keep people engaged, especially, and then we'll move on to a question and answer session. So first part, what is public and patient involvement? I'm just about to launch a poll. If you could have a click. So this is, do you have any previous experience of public and patient involvement or engagement? If you could click, it is anonymous. Okay. Wonderful, it's about 22 of the 28 done. So it is quite reassuring to see the I have no experience or knowledge not being clicked, which is quite reassuring for me. But I say we've got a mixture of yes, I feel okay, yes, I do not feel confident, and I have no previous experience, but I know about PPIE, which is nice to see actually. So I'll end the polling so everyone can see, and that is the one that has the highest. People know about it, but have no experience of it. So hopefully today we can give you sort of a flavour of what it is and what it isn't, and a little bit more information about it. So thank you very much everyone for doing the poll. So what it is and what it isn't. So research this is defined by the NIHR as research being carried out with or by members of the public rather than to, about or for them. So this is when you work with a member of the public or patient, not about them. So we have this sort of cartoon. This may be a revolutionary pill, but I'm not sure the public may be willing to swallow it. Okay, so thinking about it may be the best idea in the world, but if you've not included patients or the public in your research, they may not actually wish to take part. Okay, so just thinking about these sort of definitions, involvement is when members of the public are actively involved in research projects and in research organisations. So participation is when people take part in the research study, and engagement, which we should also be touching on today, is where information and knowledge is provided and disseminated. And that can be done by researchers and by contributors. Okay. So I thought I'd briefly touch upon this, as we do get asked a lot about this, about ethics and PPI. Lay representatives or public contributors are not research participants. PPI does not need ethical approval. Okay. However, demonstrating that you have done and will do and have done quality PPI will help you get ethical approval, and it will also help your applications, as a lot more of NIHR organisations and funding bids are asking for it to be included even at stage 1 and expressions of interest. Okay? So, common forms of PPI. I thought I'd sort of start here because this may be something some people have done and it'd be a nice place for you to think about where people could start to get involved. So, co-applicants on research grant and projects. So I'd also quickly like to talk about the misuse of this word quickly. So co-applicants, so when using the co-applicant term, you mean an individual who's involved in the development of a funding application, and if it's funded, has some responsibility for the management or delivery of the study. A co-applicant is not a PPI contributor who you've just added to your study. They should be embedded and involved fully within your piece of work, either sitting on steering committees and groups and being involved throughout the project cycle. Okay? Members of a management, advisory or steering group. So this may be someone who sits on your steering committee, on sort of who maybe looks at your ethics, who advises you on who to speak to as a participant. So this is sitting again in a more strategic position within your study. Commenting on protocols. So Cynthia is going to talk a little bit more about this later, but this is looking at your application protocols, your design, your research, everything sort of to do with the protocol itself. You can involve public contributors. And that includes looking at the slightly more sort of scientific aspects like Gantt charts and budgeting, because we have a lot of contributors who have a wide experience and knowledge that should be used for looking at these things. Advising on recruitment and retention strategies. So getting people into your study. Who should I approach? When should I approach them? How should I keep them in my study? If you're going to potentially do a project on Parkinson's patients, talking to maybe someone who has Parkinson's or a carer of someone who has Parkinson's, when's going to be the best time for me to call them, for them to attend a meeting? Who should I talk to about getting more people with Parkinson's involved? They're going to be the people with the knowledge that you need. Helping develop patient-facing materials. So this is patient information sheets, anything the public might see or a patient might see in relation to your study. You can co-produce this or co-design this with a member of the public or ask for their input in sort of how it looks. But at the same time, it shouldn't be tokenistic. If you're going to ask them and they say something, you need to be able to make changes. So a big thing that happens is with surveys. Surveys are often sort of, they're standardized, they can't be changed. So if you're going to show this to a patient, you need to tell them what can and can't be changed about your public facing materials, especially if that has been through ethics. And lastly, assisting with communication strategies. This doesn't have to be them sort of designing a communication strategy all by themselves. This could very much be them sort of touching upon who should you send it to? Where should you send it? How should you send it? Should it go out through a doctor? Should it go on Twitter? Should it go on Facebook? Where is the best place to put what you've actually found out? And this is the good and the bad. This isn't just the stuff you want to be proud of. Sometimes contributors really want to know when things haven't gone to plan, so they know sort of that you've listened to their contributions as well. So our next slide is a little bit wordy, and I really do apologise for this, but I thought it'd be good to touch upon at what point can you get public contributors involved. PPI can be involved across the research cycle. It doesn't have to just be at that stage when you're undertaking the research. So thinking about sort of identifying and prioritising, collaborating with researchers to identify topics. We think about the James Lind Alliance, which is a really wonderful place to start. I do apologise, someone is calling me. So looking at commissioning, helping decide whether research should be funded. So reviewing research applications and sort of the commissioning of different things. So people sit on many different boards to help with different things. So designing and management. Are the methods appropriate? Are the timing and frequency of appointments realistic? So a big one about this was recently there was sort of a denture trial about consenting patients, and no one turned up for the first appointment because the people they were targeting, their bus passes didn't start until 9:30. So thinking about things like that. reviewing questionnaires and PISs, and looking at commenting on ethical issues within proposals. Undertaking. So again, this is the members of steering groups, conducting interviews and surveys, and providing interpretations of findings from patient perspective. Move again on to dissemination, advising ways of sharing findings, sort of where we're going to put things, ensuring findings are written in an understandable way, so avoiding jargon, and presenting findings and distributing findings. So helping develop patient information, so we're talking about implementation here, so for new services or interventions, and adding validity to findings. We find it's patients like to know that members of the public have been involved in their work when they sort of come to read yours, and evaluating impact. So collaborating to evaluate the process. I touched upon this previously, thinking about whether or not you've got a member of the public who could be involved in looking at your research materials. Could they be involved in the evaluation of qualitative and quantitative data? Okay. So, and thinking about the ways the public contribute, and I'll talk about more of this about keeping people engaged. Like, we know face-to-face has become a lot more difficult, but also we think about teleconferencing, emails, virtual working that we're doing right now. There's a lot of ways that you can get members of the public involved that don't necessarily involve having to see them face-to-face. But we do know that it does make things harder for some groups when we aren't able to visit them face-to-face. So what is not PPI? I know we're going to touch a little bit upon engagement, but I thought this was important as well. So a healthy volunteer takes part in a sleep study. They're a participant. The public learn about research at a science tent at a music festival. This is unlikely to be staffed by public contributors. This will be researchers. This falls more under engagement. Care home staff are asked about some training they are doing. So this falls into stakeholder engagement or involvement. And we do see a lot of this where the care home staff are sort of being asked questions that could be regarded as PPI, or for example, a charity is asked about their thoughts about certain proposals. This isn't public involvement, this is stakeholder involvement. You need to be quite careful when you put things into applications that you don't confuse the two. A research group tweets about their research findings. Again, this is unlikely to involve members of the public, even though it is engagement. And a patient completes a questionnaire as part of a research study. Again, very much a participant rather than a public contributor. So all of these things, and there are loads of different sort of ideas about who can and can't be a public contributor. And I think if you're ever concerned, talking to a PPI officer is very important. Okay. So the other thing I sort of wanted to talk about quickly was avoiding tokenism. So very much, if you feel that what you're doing won't make an impact, it probably won't make an impact, as it is tokenistic. Adding someone's name as a co-applicant just because it looks good will not look good in the future if you're asked why this person's been involved and all they've actually done is said, yes, they like your proposal. So being sort of very aware of sort of why you're doing things. Okay. So moving on to sort of public involvement and engagement. So what is PPI or PPIE? So public engagement, or just engagement, is where information and knowledge about research is provided and disseminated to the public. So without engagement, there is no patient and public involvement, which is sort of something that was said to me by my PPI lead. We need one to have the other, and it works both ways. So recently, Involve, which some of you may have heard of, sort of finished and has been taken over by the new Centre for Engagement and Dissemination, or SEED. So SEED brings together activities in patient and public involvement, engagement and participation, sort of with its main aspect is looking at research dissemination. It builds upon the work of Involve. So the new centre will lead the NIHR's work to make healthcare research representative, relevant and ready for use. So their new website is not up and running yet, or else I would have linked you to it now, but it is still very new, and at the moment they're undergoing sort of consultations of how to take sort of all the resources that existed upon Involve's website to the new one. So who I wanted to talk about is Eric and Carmel, and I think Carmel might even be on listening to this right now. So thinking about engagement and involvement, Eric is a public contributor who works with one of our PhD students called Carmel. He moved into more of an engagement role when he spoke at multiple conferences with her, but he's a really big part, an integral part of her work to do with public involvement. But his skills at engagement have meant he's one of the best things when you go to a conference. He's one of the few public contributors, if not only public contributor at a conference, that people get to listen to, get to hear from, and hear about his experiences working with Carmel, which is incredibly powerful and important. And I think sort of leads us to sort of see the importance of engagement, especially when it comes to contributors, because without this, they don't know the importance of the work they've done and where it's going. Okay. So I would now like to introduce Cynthia. Cynthia, if you tell me when to click next, I can move throughout the slides, okay? But say, thank you for joining us today.
Thank you.
Okay.
Good afternoon, everyone. I'm going to talk this afternoon about my role on funding committees and about lay summaries, jargon, and some hints and tips on how to make your lay summaries and your PPI contributions simple and straightforward to read to other researchers. Over the last 10 years, I've been privileged to sit on many NIHR and NetCC funding committees. I've also sat on health technology assessment, research for patient benefit. I sit on the Academy at Leeds for the CDRF Global Professorships. I also sit on 2 funding committees for the Academy and for the National Priority Group and for the Applied Research Collaboration ARC. My professional career in publishing training manuals up to my retirement placed me quite well to review research applications, because I also bring experience as a carer and a patient perspective to this activity. The following slides are what I consider important elements of PPI in a good research application. You can go to the next one, please. Let me just talk briefly about other reviewing perspectives. PPIE should be comprehensive and valued in the same context as the rest of the research. Ideas, values, and patient and carer perspectives from pre-research workshops or focus groups taken into account and incorporated into your research paper. That is, what ideas have come from your workshops where you've talked to PPI members? How has that changed or modified your research? Carer and patient included and valued on your steering committee from its inception right through to dissemination. And in dissemination, I'm talking about perhaps dissemination to local groups, social media, or maybe even national journals that are not medically focused. Training and mentors or support should be arranged for your PPI members of your steering groups. They may not need training, but it should be in place in case they feel uncertain or they are not fully understanding that particular point in the research. The other item that has to be considered is costing. You need to cost appropriately for the whole of your research, whether it's 1, 2, 3, 4, or 5 years. There are guidelines that involve guidelines, now CED, and that will guide you through, but make sure that that is in your costings, in your budget, because it will be... Excuse me, I've just got to kill the dog.
Sorry, everyone. We had hoped that Barley would stay asleep throughout Cynthia's presentation, but it sounds like he's woken up. We just give her a second to calm the dog down. And this is one of the joys of working from home. And I'm going to plug here to say this is why it's really important to sort of be aware of your different contributors' needs and what could happen during a PPI meeting, which is what has just happened. Cynthia?
I'm back. Can I have the next slide, please, Catherine? So what do I look at? What am I asked to look at when I sit on a funding committee? I'm asked, of course, the first thing I'm asked to do is to look at the lay summary. And what I like to see are short sentences, and I'm going to explain how you can achieve that in another slide. So short sentences, roughly 14 to 21 words per sentence. The lay summary should be jargon-free or the jargon explained in simple terms. And you have to understand that there will be PPI members reading the lay summary on committees, and they may not have experience of your particular type of research. So keep those people in mind when you're explaining your jargon. Acronyms also need to be explained. And in order to make your lay summary easy to read, I do recommend that you use paragraph titles. Next slide, please. Jargon and acronyms. Jargon-free with acronyms explained. When you are sitting on a funding committee, there will be possibly 12, maybe more, of the great and the good reviewing your application. And they will be from many areas of medicine. There will also be statisticians, economists, there may be a dentist, and there will certainly be public and patient reviewers. A dentist or a public and patient reviewer may not understand some of the medical terminology, so make it easy for them, explain it. Also, when results are disseminated to the general public, make sure that anything that is medically focused is explained, because local groups, even national groups, jargon may not be familiar to them. And acronyms obviously fall into the same category. Next slide, please, Catherine. Paragraph titles. It's wonderful if you see a lay summary with paragraph titles, because it makes it much easier to read. You understand the flow, the context, or the trajectory of the research. It enables the reader to comprehend what is sometimes highly scientific medical content. So paragraph titles will aid this. So titles such as the background to the research, your aims and objectives, individual goals or work packages, dissemination, and whether or not you've included PPI, E, and appropriate costing. Next slide, please. Now, in order to achieve the 14 to 21 word sentence, I recommend that you have a look at the Gunning-Fogg test. And just to put it into simple terms, if you remember Churchill's great speech in 1940, and I'll just read it very quickly, his speech was 7 words per breath. It was very punchy and very memorable, because here we are now, 70, 80 years later, and a lot of people still remember this speech. We shall defend our island, whatever the cost may be. We will fight on the beaches. We will fight on the landing grounds. We will fight in the fields and in the streets. We shall fight in the hills. We shall never surrender. Those are very short, punchy sentences. Next paragraph, please. The Gunning-Fogg test is actually a mathematical formula, so it will appeal to a great many medical people, particularly statisticians, I imagine. It's a formula which many publishing houses use, and they use it so that the authors, by the number of words in their sentence, can address the public that that document is supposed to be addressed to. So it's no use writing a 60-word sentence if you're writing a children's novel, for instance. So you would want, if you're writing a child's book, you would want 7 to 12 word sentences and so forth, and up the scale. When you get to the heady level of professor, then you write in 60-word sentences quite often. And you've got to find that medium. Most of the broadsheet and tabloid newspapers, most of their sentences are in the 14 to 21 words per sentence group. And that addresses the GCSE O-level, A-level group of readers. I find the actual mathematical formula quite difficult to cope with, but it's on the internet if you want to look it up. But the way I do it is I just count the words in the sentence, and hopefully they are in the 14 to 21 group. But do beware, any word with more than one syllable should count, those syllables should all count as one word. So take care with that. Try and address your lay summaries in the Daily Mail, Telegraph or Guardian newspaper readership words per sentence. 14 to 21 is about right. Next, please, Catherine. Finally, just a quick summary here. A good writing style considerably improves our ability as reviewers and researchers to communicate ideas and to understand ideas. We should always try to express ourselves as clearly as possible. Jargon, acronyms, and medical terms should be explained simply. Words with more than one syllable can be confusing for those with poor literacy levels or who are unfamiliar with your area of research. Information should flow like a river, always in one direction, and paragraph titles can help with this. And finally, don't lose your reader when you have such important information and ideas to communicate to them. We don't want, when we're reading a lay summary, to constantly going back within that summary to find out exactly what the research is about. Let it flow like a river. I'll try. That's my little memory note for the day and how I'd like to finish. Thank you very much.
Thank you ever so much, Cynthia. And like I said, there'll be time for questions at the end if anyone sort of has any additional questions about sort of what Cynthia has spoken about. So thinking about now, how do I keep people engaged? And this is a big problem for both sort of PPI and research as a whole. So keeping contributors engaged. Sort of PPI sometimes can be seen as a one-off activity, and it really shouldn't be. You need to think about the training, the opportunities, and what these people are giving you. Most people become public contributors out of altruism, or unfortunately because something's gone wrong and they want to make things better. So you need to think about what sort of what that person wants from contributing. This is especially important if you're doing involvement in the community, sometimes referred to as PPCI, public, patient and community involvement. So how this person is going to make a potential huge difference to your work, but also they're giving you a part of their story, and how will you support them throughout that. Thinking about how much time you can give to this and not over-promising is a really big thing. I know we all want to do the best in the world, and letting people know what you can and can't do can make sort of conversations more honest. And sometimes what we do is we engage with gatekeepers in community work. So for example, we might engage with someone who runs a Parkinson's group or the head of the Age UK section in Hampshire. and ask them to spread information to the people that they know, rather than trying to contact all these different people and maintain relationships with them. It's about sort of working smartly when we work in the community. But also, building relationships can only benefit your research in both the short and the long term. When you've built those relationships, thinking about how your research will help be benefited in the short term, they're going to look at your work, they're going to sort of tell you what's good, what's not, they're going to review your English summary, they're going to contribute to this piece of work you've done, but they're also going to challenge you and inspire you to think of where you could go in the future. So, I haven't mentioned it so far, but this is the C word, COVID. So COVID has created a new world for public involvement. For the good and the bad, we've had less and more time to do things. Research, unfortunately, a lot of projects were paused. Researchers had to move on to different projects or recalled to clinical work. And this was an amazing thing that they did, but it led to contributors, unfortunately, being bereft of pieces of work if they weren't able to find out what had happened to the study they may be contributing to. We also know the speed of research increased greatly over the past 6 to 7 months. Things were done in time periods we'd never experienced, and probably you are still experiencing at this time. On the flip side, it meant that you could talk to people from all over the UK, from all over the world virtually, about your research project. There was a chance to engage with people maybe you never had the chance to engage with. And because the UK, I believe, especially in Southampton, became very interested in research, you suddenly had a large group of people who wanted to be involved and wanted to know more about research. The movement to virtual work empowered some groups, and we lost the voices of others. We had a wonderful sort of surge of people to be interested, but we realized very quickly some groups found online working incredibly difficult. If you have some forms of learning difficulties, found talking to people online incredibly hard, and it was not a pleasant experience for them. I talked to MenCap previously and was hoping to go and visit them, but the online working is difficult. We've also done some work with Sure Start centres, and that immediately had to cease due to the lockdown. And then going and visiting them has become difficult. And these are young families who aren't looking at engaging online. They want to see people face to face. As I mentioned at the beginning of the pandemic, a lot of PPI activities were halted and people moved around. So sharing information and dissemination and engagement became really hard because you didn't know who would have that information you were looking for. So working differently. So this is a nice picture of one of the big things that we've done as an organisation in Southampton and Wessex is we've set up virtual meetings and virtual coffee mornings, which has been a way to bring contributors and researchers together. And a lot more organisations are beginning to do this as they realise the value of virtual working. However, support and training is required. It's not worth just sending people a link in the email. While Zoom is friendly, not everyone can access it if they've never used it before, and we shouldn't assume that just because we're 7 months into a pandemic, everyone knows how to use Zoom. They don't, and some people need support. At the moment, NIHR is advocating that you pay people an extra £5 per online meeting to meet electricity costs and any other costs like printing that they may have to do. And we've been big advocates of this. Telephone calls and email interviews are still a good alternative. People still want to talk on the phone, and there are lots of examples of email interviews that the NIHR sort of endorses, and I think it'd be worth looking at those if potentially you want a slower form of communication. But also we need to adapt to what charities, groups and services are doing. We can't just hope they'll do it our way. There's a big thing within universities to use Teams, but we know contributors like to use Zoom. I don't think anyone's using Google Hangouts, but at the moment there is this sort of push between the two of what researchers use and what contributors want to use and what charities and groups like to use, and we need to adapt to them. Also, tell the public what is happening in your research. I said sort of the good and the bad, like tell them if it doesn't get funded, like tell them what you need to move forward. one of the talks we're going to have at our online coffee mornings is a researcher who came to us in April, is going to come back and tell us that she didn't get funded, but these are the reasons she didn't get funded. That level of honesty has led to a big engagement with her work because people know that she's going to tell them the truth. And that's really important for contributors at this time, when levels of trust in scientists are still really high, and we want to keep it there. So, talking about getting help and support, this is a bit Southampton-centric, I do apologise, or Wessex-centric. I sit within a team that sort of operates throughout Wessex, led by Caroline Barker. Michael Brahimi Hasuri works sort of out of UHS for the BRC, the Biomedical Research Council, and the CRF, the Clinical Research Facility. I support the Applied Research Collaboration. Barney Jones supports the Wessex Patient Involvement Network, which is all NIHR organisations across Wessex. And Carmel, who I talked about earlier, is a PhD student looking about the impact of PPI and health research. Also within our area, we have Megan Barlow-Pay, who's the PPI advisor for the RDS South Central, who I'd always advise talking to when you're looking at putting in a proposal, and Sonia Newman, who is the PPI officer at the School for Primary Care Research in Southampton. I think if you'd send any of these people an email, they would try and help you in your PPI activities. So getting help and support. So what can a PPI team do? And these will exist if you're not based in our area. So, and we can always link you towards people who may be able to help. So they can provide expertise and advice. They're a sounding board. We don't mind you asking questions. We'd rather you asked us now than 2 days before your deadline. We can signpost you to the appropriate resources and templates to support your activity, like an advert template. We can help you review plans or documents. And we can also look at training and support. So recently there's been an online training course run by Caroline Barker and a public contributor, Pam Holloway, where they did a session of 5, getting people involved in a more intimate setting in public involvement, which was incredibly popular, and we hope to run again. We've also got training coming up on presentation and building virtual confidence. So there's all these things happening to help people in their PPI. So supporting advertising and recruiting to PPI activities. So access to committed public members willing to provide support. I know it says face-to-face here, but it is going to be online currently. So skills, so facilitation and working with the public. We know that having someone there to help you, especially if it's your first time involved in public involvement, can be a really big thing, and that's something we really want to help people with. Innovative approaches and opportunities to interact with diverse and underserved audiences. I sort of mentioned the Sure Start Centres, which is helping young families within our Southampton area. We do reaching out and diversity work as well, which the team participate in. So I'll say thank you very much for listening, everyone, and for coming today. And we sort of wanted to welcome Paul back. And sort of if you have any questions, I've not looked at the chat at all.
Okay. Yeah, so we do have a couple of questions and a couple of points in the chat, but if I ask those, if anybody else has anything burning that they want to put it in the chat, and then we can kind of follow on with those things. So the first one is from Christina. You talked about training, but what sort of training could we provide PPI members, and do you have any examples?
So currently, some of the training is quite informal, and Cynthia can probably talk about this as well. It's an informal process, especially for quite a new contributor, but we provide training on doing lay reviews. We have lay review training. The two of the training coming up, the presentation training will be for contributors and researchers, and the building virtual confidence will also be for contributors. We use a lot of the involved resources to sort of, especially if someone is looking maybe at sitting on a steering committee or sort of wants some more advice, we would signpost people towards the involved resource. Or what we might do is signpost someone to Cynthia if they were interested and wanted a conversation about being more strategically involved. So we do try and sort of sometimes bring different contributors together to sort of help them. Anything else you want to add, Cynthia?
Yes, I'd just like to say that when we're reviewing funding applications, we do look to see that training and support has been provided to the PPI members. And it may be just in the areas that you've just mentioned, Catherine, or it may be that perhaps there is on that steering group or within the team someone who can mentor them, particularly if when you're in a group meeting. Quite often the others on the steering group, particularly the researchers, they forget that they're using terminology which is not common to the PPI members. So it's quite nice to have a mentor within that group, someone who they can just tap and say, what does psychoanalysis mean? You know, it's just nice to have that person, because quite often PPI members, it's not that they're shy about asking, but sometimes it's not appropriate to interrupt the flow of a conversation in a meeting. But it is, you know, if they could just write down a word or a phrase that they're not familiar with and give it to their mentor and say, could you explain that to me afterwards, please? So it brings them up to date with medical terminology.
Thank you very much. I think Clarissa also has highlighted a toolkit for good kind of PPIE. So possibly some sort of online virtual tools there that might help support people as well. So we've got another question from Katie. So do you provide support for co-production in research with patients and caregivers?
Yes, so sort of thinking about co-production, I think this relates back to sort of Cynthia's idea about the funding. If sort of you have the funding for co-production, we can sort of help you design sort of a budget and how you're going to need to use it to do co-production. And then very much if you sit within one of the organisations we work with, we can help sort of facilitate meetings and sort of help you organise maybe, I think more in face-to-face times we'd have helped you sort of sort out transport maybe for carers, vouchers for carers, and we'll be able to sort of think about those things that you'll need in order to do co-production, which is why it's so important to often talk to someone from the RDS, the Research Design Service, or a PPI officer, because they can help talk through these conversations and sort of think about with you where you're going to need the money and where you're going to need the support and training. And that's one of the biggest things I think I can say is talk to people about your PPI plans, and because then they'll be able to point you sort of in different directions.
Great, thank you very much. Actually, one question that popped into my mind, actually, there may well be a number of people on the call who are sort of midway through a piece of research or and are not necessarily putting in a bigger funding bid, but are there pots of money, things that can be applied for as like sort of just purely for PPI, or is there any kind of central resource that you can kind of call on if you're partway through a project and you want to do something to support a particular project? So
there are different pots of money depending on what people are thinking of doing. So if we're thinking about engagement and dissemination, Southampton has the Peru Fund, which I believe is public engagement with research, which is things people can apply for to think about dissemination activities and how they're going to do different bits and pieces like that. If you're thinking about going forward to your next proposal, the RDS have a pot of money that you can apply for to do sort of public involvement before your next proposal. There unfortunately is not a sort of a central pot of money if you're halfway through a proposal. You can engage with public contributors without paying for them, but you have to be very honest about this, and it's something we would rather you didn't do, because it's very important to pay your contributors for their time. But I think thinking about engagement, it's definitely the Peru Fund. And if you're looking at going towards something but don't have the resource, talking to the Research Design Service, as they do have pots of money to build towards your next research proposal. Is there anything you can think of, Cynthia?
No, I mean, sometimes I have been approached from new PPI contributors, and they've asked me sometimes quite difficult questions. And I think the important thing there is always to get back to either the RDS or to yourself, because even though I'm a long-term PPI contributor, we don't have access to funds, and sometimes we don't have access to the information that they need. And it's all about collaboration. It's working together with people like yourself and with Caroline and with other PPI members that you have contacts with to gain that information.
I think as well, just sort of to bring in another point here, PPI doesn't always have to be as structured. And I maybe didn't say this as we've talked about today. I had a lovely conversation with a researcher recently who'd had some conversations with some other sort of people who knew sort of family members with dementia, and she talked to them on Facebook and had conversations, and like, they'd looked at her research and they'd had sort of these lovely sort of interactions that were very personal that she then took and changed things. And I had said to her, this is public involvement. It's not been formalised, you've not set up a meeting, I know you've not paid them, but this is public involvement in its most basic form. You've asked the public what they think, and then you've gone and made changes. And I think sometimes we need to think about, we don't need to create these structured groups. We don't need to create a brand new Alzheimer's group or a support group or anything like that. We need to engage with who we've already engaged with. And sort of thinking about the people you've talked to. And especially at this time during COVID-19, sometimes those more intimate conversations make people feel more comfortable about sharing stuff. And there's nothing wrong with that. But yes, so definitely thinking about that. As well as thinking, if anyone would like to ask a question rather than putting it in the chat, we'll keep an eye out.
Yeah, absolutely. I was going to just give an opportunity, actually, if anybody who actually wants to unmute and actually ask a question, please do go ahead.
I've just seen sort of someone ask about the recording, Paul. Where will it be available to people?
Yeah, so there will be a recording, obviously, of this video. So that will be distributed by those who've sent out the invite initially, but it'll also be available for ECRs at Southampton on the ECR Teams page there, and I can send out links to that. And I know that Maggie Donovan Hall, I think, is also going to post it on Blackboard for any kind of undergrad or postgrad students who have access to Blackboard. Okay.
Another question pop up.
Oh yeah. So yeah, question from Andy. I'm a member of the patient participation group at Newport Health Centre, Isle of Wight. Do you do any work or provide any support on the Isle of Wight? Alternatively, is there any organisation on the Isle of Wight who we should be looking at for support? And is there any way that PPG could support research PPI?
All right. Well, hello, Andy. And this is the other thing. If you turn your camera on, we'll be able to see you because you'll pop straight to the front of the queue.
Hi.
Hello, Andy. Actually, so this is quite fortuitous. So a lovely lady called Sandy. If someone else wants to say her surname, Cynthia, how do I say Sandy's surname?
It's Italian.
It's Italian. So there's a lovely lady called Sandy who is running a virtual volunteer fair on the Isle of Wight. And the Applied Research Collaboration has entered a video to this for people to get involved in public involvement. And that will sort of be launching over the next couple of weeks. Because what we'd like to do is have more contributors from the Isle of Wight. And we don't have to make them get on a ferry anymore. So I think we should have more people. So no, there is a lot of different things you could do. It doesn't have to be Southampton centric. The ARC is quite a good one to think about because it's Wessex wide. And the research covers, when I say Wessex, I do apologise, it's that old ancient kingdom of Wessex. It is Hampshire, Dorset, the Isle of Wight and some of Salisbury. And so there's a lot of opportunities to get involved in public involvement from sort of in their perspective and to think about what you'd like to be involved. So yes, I think that's definitely something I can find out for you. And sort of if you're happy to put your email in, I can email you about the different things that are coming up. And I can email you my slides too.
Thank you very much.
That's fine. And you said about a PPG supporting it. This could very much relate back to thinking about sort of the gatekeeper idea. If you've got someone who's maybe a spokesperson or would really like to share stuff with the group, they could be the person that sort of talks to like the research groups as a contributor, and then takes everything back to their PPG and asks them questions and sort of sees what they like to be involved in. That's a sort of a perfect example of a gatekeeper for a group. But no, that's definitely something. And we do bits of work with some PPGs in Southampton as well.
Thanks.
Thanks very much, Andy. Actually, I just wanted to, one thing I wrote down, actually, you mentioned online coffee mornings, Catherine. I don't know if any of the researchers or anybody who's on the call actually would want to know kind of any more about, or any future dates for that.
Well, Cynthia, are you happy to share a little bit about the coffee mornings? And I'm just going to find out some info. I'm just going to pull up the dates for them.
Have you got me? Yes, okay, I'm not mute. I found some of the coffee mornings really interesting. They've been arranged for Mondays, Wednesdays and Fridays, not every Monday, Wednesday and Friday, but other people within the PPI group in the wider area of Wessex, we've got to know each other very well, and actually it's been very friendly and very inclusive. Sometimes we've just had a chat between ourselves, and on other days Catherine has organised a speaker. Sometimes the speaker has been relevant to your particular area of interest, and sometimes actually it's something brand new that you didn't know about, and it's actually possibly even more interesting because it's quite new. And they've been absolutely wonderful. We felt very much part of a community, and I'd like to thank Catherine for doing that for us. Thank you.
Thank you, Cynthia. So yes, so these run sort of throughout the week, and we have sort of normally a different researcher each week come speak about their work. This is a really nice place for sort of engaging and dissemination. It's not a space for public involvement. We do ask that contributors and researchers take that sort of further on and then are paid for their time. But it's also a really nice place for researchers, especially if you've not presented online or virtually. It's a very friendly space for you to come and share your research, share your work, and sort of talk to people about it. And we've got a very inquisitive group of contributors who like to ask lots of different questions, and we've had many different speakers. I think so. In the next so tomorrow we've got Jackie Perito, a researcher from University of West London, coming to talk about urinary tract infections amongst older people. We've got Catherine Pointer coming to talk about the work of the Experimental Care Medicine Centres, the ECMCs. We've got Daniela Watson coming to talk about saliva testing for COVID-19 amongst hospital staff. And we've got a researcher coming from the Philippines to talk about diagnosing COVID-19 in the Philippines through intelligent systems. So we have this lovely range of speakers who've just come, and these have been running since April. We do social sessions as well, but for any contributors who are maybe listening or people who are interested, we're going to do a welcome one in November, sort of like a meet and greet for you to meet the team and to hear a bit more about sort of what the coffee mornings are all about. And then just before Christmas, we're going to have one about Christmas traditions, which will also be quite a nice one to join as well. So I'm more than happy for people to contact me about these and to ask questions, and I will put my email in the chat. But it's a really nice place to meet contributors and also sort of to hear about what else is going on. Like, there's nothing wrong with researchers coming to listen about the research topic if there's something you're interested in as well. But you might be nabbed by a contributor and asked what you do as well. But no, all are welcome to these.
Okay. Well, thank you very much, Catherine and Cynthia. So grateful for your time this afternoon and all your work in developing those slides as well. So the video will be available, or a link to the video will be available. So for those who aren't already connected to Kappa, if you Google Kappa, so CAHPR and South Central, then you'll find the website. They also have a Twitter handle, which is @SCCAHPRN, where you'll find kind of new and events that are coming up. And at Southampton, we have an ECR team in health sciences, and all of the information is held on a Teams page there, so anybody can kind of access and kind of request access to that page. So unless there are any other further questions. I know we're kind of coming up to 3 o'clock, so we'll close the session and just say again, thank you very much to Catherine and Cynthia.
Thank you for inviting us, Paul. It's been lovely. Thank you, everyone.
Thanks, everyone.
Thank you.